As of now, a little more than 75% of California hospitals have a negative operating margin. A high inflation environment is always difficult in a hospital delivery system. You couple that with the impact of staffing shortages and kind of, pandemic, kind of resetting the deck for lots and lots of industries and certainly labor engagement. It makes it a very challenging time right now. So that's one side on the expense side. The other thing is that revenues really haven't changed. And if you look at, as I mentioned, our payer mix is, more than three quarters Medicare and Medicaid. California hasn't changed their reimbursement rates for Medicaid in more than 10 years. And so in any aspect of our environment where, we all rely on personal revenue for our personal lives, if you had that stay flat for 10 years, while expenses increase, it presents an incredibly difficult environment. And that, in a nutshell, is the challenge. I think that if you look at our total overall dollars associated with healthcare delivery in this country, there's a lot of dollars. I think it's inequitably distributed right now. And I think all you need to really do is look at the profit reporting in various segments, and you can kind of see where the imbalance lies. Hospitals are a critical piece of the healthcare delivery infrastructure and should be reserved at the very top end. Without that piece, overall community health declines because your overall mortality rate as a community goes up. So I am worried in communities where you see hospital closures and nothing done to replace them. Over time, the health of that community will definitively go down because access to immediate acute care, life-saving care is not readily available. Healthcare has gradually, over a long period of time, we've continued to squeeze down and squeeze down and squeeze down to be as lean and efficient as we possibly can. And that's not necessarily a bad thing, and there's a big but with this. When you come to times of crisis, when there's no extra flexibility in the system and no additional resources, it gets to a point where people say, this is too hard and it's too much. And so I'm going to have to step out. And that's what it feels like right now, because we do have a very high cost of healthcare overall, globally, in this country. But I'm not sure that we have all the money in the places that it needs to be. I mean, I think we've had record profits in health plans now for some, significant period of time. And if you look at hospitals and what's happening on the reimbursement component and where we're at with the federal reimbursement, you can kind of see, are we investing where we need to in order to provide the stability and foundation we need to actually deliver the care?